guys, welcome back to my channel, and I'm back again with Dr. Michelle, and today we're going to be talking about breech babies. So breech is usually a term that people use for if your baby is head up. You can also have a transverse baby, which is your baby is lying sideways. And usually babies kind of chosen their position by about 36 weeks, right? At UPHealth, you guys have a very interesting protocol for trying to turn babies.
It is not 100% that we can change the baby's position. There's many factors to why the baby is breech. One factor that we chiropractic address specifically is related with the alignment of the mom's pelvis. So the understanding is if the pelvis is not in a good position from an alignment perspective, if there's a lot of very tight muscle tone that's in place, that can affect the overall stretch of your uterus as well as affect the actual physical space the baby have. So for chiropractic, some of the technique is very much focused on realigning the body from the pelvis perspective, but actually also improving the uterine alignment from inside the pelvis, because it is attached to the pelvis via ligaments as well. So by improving that, we are maximizing the amount of space the baby can have. And of course, the understanding is, baby inherently and innately should want to turn and should know how to turn. So with that assumption in place, our job is to remove the roadblock in place, which is related with the physical space that the baby has. So by improving that alignment, we are encouraging the baby and allowing the baby to have more space to work with. Most women are aware that the baby is not head down even earlier, so say 32 or 33. And again, coming back to what we just discussed, which is related with the amount of space we have, we do encourage earlier intervention if possible, instead of waiting for exactly that 36-week mark, because the baby is much bigger and there will be more other factors in play. We always encourage as early as you are thinking about this and concerning about this, once you kind of pass the 32-week mark.
So I've been seeing you from, I think, maybe 6 months pregnant, and I'm now 8 months. And I feel as though my pelvis is I had a completely shorter leg, because my pelvis was that misaligned on one side. And even as the pregnancy has gone on, it still keeps on trying to get back to that old movement pattern. And that's why weekly appointments is really important, especially through third trimester.
Yes, 100%.
I just noticed it for myself, and we noticed the other week that my baby is favoring more space on the right hand side, because that's where I naturally have more space, because my left side is tight. So using the techniques that we spoke about in a different video, the activator, and just aligning the pelvis has really helped make more space on that left side. At UPHealth specifically, you guys work with TCM and chiropractic.
Another thing that is also it is worthwhile for women to consider from a trial perspective is moxibustion. So moxibustion is a TCM technique, so Chinese medicine technique. They use these herbal stick and they burn it and they stimulate certain meridian points actually on the toes. And the theory is that it does encourage the baby to move. So in UPHealth, because we also work with TCM in the same clinic, so many cases what we try to do is actually doing the chiropractic adjustment and the moxibustion on the same day, because that we just find that it really maximizes the effect a little bit. So one work on the mom's aspect, freeing up more space, allowing the pelvis to be in better alignment, which gives the baby more space, and then the other one encourages the baby to move. So the two together seems to have a little bit of a better results, so to speak.
And the reason why head down is more important as well is A, so you have a more comfortable pregnancy, but B, if you would like a vaginal delivery, obviously you want baby's head down. People don't readily perform breech vaginal birth anymore. Most people opt for cesarean straight away.
Especially in Hong Kong.
Yes, in Hong Kong particularly, no one here will touch breech birth. So you will have to get a C-section, and obviously just a con of the C-section is the recovery time postpartum. And if you have multiple children, you don't really want to be, recovering from a surgery for 6 weeks after. Yeah. Michelle for all of that amazing information. You can check out more at UPHealth HK. All right, bye guys.